I've been in nursing for over 30 years, so I'm a caregiver. I'm born and bred to be a caregiver. And I think that unfortunately today it's difficult for people to get the care that they need. And I don't think that people should have to do without care simply because we don't have the finances to pay for it.
The partnership with Susan G. Komen and Terry Reilly and St. Alphonsus Nampa is a great partnership. We have what's called the Canyon County Breast Care Coalition, and Southwest District Health and Terry Reilly and ourselves are all a part of that coalition. And in turn, it's just partnering to provide services to women in need. So the constituents at Terry Reilly, the patients there that need screening mammograms, in turn come to St. Alphonsus for those mammograms. And it's just being able to have that partnership with Komen providing the funding and then us delivering the services.
Terry Reilly's mission has always been that no patient would ever be turned away for care that they needed, and we really strictly stick to that. We receive grant funds from Komen, which allows us to take our patients who really couldn't afford mammograms and basically don't have insurance, and we're able to enter them into the larger community health system. So like we partner a lot with St. Al's, and we also use St. Al's to have vans go out to some of our more rural clinics because our patients don't drive, so they're not able to get into St. Al's.
We serve on average about 350 women every year with free screening mammograms. And then from those 350 women, we have an additional 50 that go on that need diagnostic services. Right now we have a wait list of over 40 women waiting to get in to get their annual screening mammogram based off of funding and the need for funding.
I don't think that we'll ever have enough resources to meet the need because the need is just tremendous. But the more people are able to support organizations like Susan Komen with donations, the more people we're able to take care of.
People giving to Komen and by participating in the Race for the Cure directly impacts us locally and the services that we provide, and being able to provide those annual screening mammograms for women, diagnostic services, support services. It's just walking in that one-day race and donating back to Komen. 75% stays local, and that is huge. It makes a huge impact, and so the giving and more support towards Komen that we can get is the better off we're going to be.
It's kind of amazing because the first race we went to that year, my sister-in-law had been diagnosed with breast cancer and actually had a radical mastectomy, and she's a survivor to this day. And so we kind of take it personal. And then through Komen and our involvement in the Komen race, my wife has never had a mammogram done. And after we had attended our first Komen race and gone through some of the education and some of the various booths there, she went and had her first mammogram done.
The demand is huge. If we had additional funding, we would be able to serve more women every month, which in turn, early detection is key. So we need that funding to provide for those women on that wait list.